I think all the rage in immunotherapy in lung cancer has been combinations of immunotherapy plus chemotherapy drugs. I think we're seeing some really exciting, interesting results. We've seen it in non-small cell lung cancer. We see it in small cell lung cancer now, that a combination of chemotherapy plus a checkpoint inhibitor can be effective even in small cell. I think there are a couple of issues. One is that I think a number of different checkpoint inhibitors now have been combined with chemotherapy, and again, mostly PD-1, PD-L1 inhibitors, and they all are showing pretty uniform clinical efficacy data. I think there are different chemotherapy backbones that have been used, so again, indicating that many of the commonly used chemotherapy backbones can be used in combination with the checkpoint inhibitors. I think the data also suggests that maybe this quadruple combination with the VEGF inhibition plus an IO plus a platinum doublet, at least in a specific patient population, can be effective. I think we just have to be careful. Quadruple therapy might not be for every patient who walks in through the door. Toxicity is a little bit more. The chemo backbone can have additional side effects associated. So I think it's a very sort of thought-provoking and hypothesis-generating study, but perhaps we need to move towards platforms that are somewhat better tolerable. I would say for my patients, I would always use a platform or a backbone in terms of chemotherapy that I think is a little bit less toxic to use. Every time we combine 2 or 3, 4 drugs, we know that we're going to get additional toxicities. Even when they're minimal, there still is additional toxicity. So in a case like that, I would rather use a platform, or I would say a chemo backbone that gives me less side effect.